This is Dr. Jonathan Lebowitz of Lebowitz Plastic Surgery, located in Huntington, Long Island, New York, the Long Island Gynecomastia Center. Today, I'm adding to my YouTube video channel a young man. He's 18 years old, comes to me complaining of that one nipple, his left nipple, is larger than his right nipple. He sees this through light-colored tight shirts, the one nipple, and he just wants this one left side nipple reduced. So today we're doing a nipple reduction surgery. Under local anesthesia, he's awake. He has no gynecomastia, he has no kind of nipple rock, as I call, underneath here. I've already numbed him up, so this side looks a little bit more swollen than the other side. He's already had some local anesthesia, and it's done under purely local. So I'm going to make it the same size of this side, a little bit smaller. I've actually talked to him about it, a little bit smaller than this side, but he wants some nipple showing, which is, of course, normal. So the procedure, what I do for the nipple reduction, I like calling it a Mexican top hat, and it looks like a Mexican top hat. So this is the base of the nipple. So for the anatomy, this is the nipple and this is the areola. The brown thing around it is called the areola, and that's the nipple itself. So that's the areola and that's the nipple. So I do what's called a Mexican top hat. So it looks like I'm taking a top hat off of this, and I do a lot of these nipple reductions. He's already numb. If you feel any, let me know. Okay. So we're going to make a little base here, cut here. And my results are guaranteed. If he comes back to me and says, it's a little bit too big, I want it even smaller, that's included. So I tell people for gynecomastia that my results are guaranteed. If it ever grows back, I do it for free. See if your nipple ever grows back. Just trimming it to make it perfect. Let's see. That looks great. So the reason why I call it a Mexican top hat, I don't know, maybe it's just me. So let me show my audience what I mean. Maybe I'm wrong, but it looks like a tat. See? So I took a chunk out right in the middle, and that comes out, and I'm gonna wrap it around to make it a little less projection and a little bit less diameter. So this goes right like that, boom, and out. That's the Mexican top hat. This, it looks like a little hat. Or maybe I should call it a yarmulke. Maybe I'll call it a yarmulke. It's a little yarmulke. It's a yarmulke technique. Right like that. See, that's the yarmulke, and that the yarmulke comes off. This is a little cautery, stops little tiny blood vessels. But I use a epinephrine to make the blood vessels go away. Okay, so now we're going to put it together. And the way we put it together, we have a little, and these are all self-absorbing stitches. They're very tiny. So that is my nipple reduction surgery. So that's the right side, the one we didn't touch, and that's the left side. Now remember, it's a little puffy because of the local anesthesia, but that will be the same size as this one, maybe a little bit smaller, because he wanted it just a teeny bit smaller than that side. So this is Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery, just completing a case of nipple reduction surgery on the one side, unilateral on the left side, to match the other side. A young man, and just self-conscious about his look in t-shirts, and really without a shirt too, playing basketball, where he complained that the left nipple protruded more than the right one. And the simplest thing for him, easiest thing for him, was just to reduce the nipples, because he really has no gynecomastia, meaning no nipple rock or puffy nipples underneath there. And this will give him a permanent, fantastic result. Again, my results are guaranteed, so if he feels that this is a little bit bigger than this side still, which I don't think it is, I think it's perfect, to a little bit smaller than that side, he'll wait a couple of months, he'll come in, no charge, and we will do it again, all under local anesthesia in my office operating room. This is Dr. Jonathan Lebowitz, the Long Island Gynecomastia Center, just completing a surgery on nipple reduction, unilateral left side. Thank you so much, and hope to see you soon for any and all of your male chest gynecomastia needs and concerns. Thank you.